Welcome to That's My Biz, the Internet Business Showcase, where we bring exposure to products, services, and special causes of local businesses and organizations. Thank you so much for joining us. We are coming to you live from the BizLinks TV studio, brought to you by Visual Marketing Mentors, LLC. Hello, everyone. Welcome to another episode of That's My Biz. Oh, I tell you what, we always have some good businesses that we're out there meeting and some unique businesses, I think, too. And that's why we just love bringing them to you, because these are businesses that you need to know about, because we want you to support them. If not with your own dollars, to be able to pass some business on to them, pass some referrals to them, because some of them are very specialized. And I have one, I think, today that's a little bit different, a little bit more unique forward. But we want to share with you Miss Sharon Jones with Health-ettes. Thank you so much for joining us.
Thank you. Thank you for having me.
Absolutely. Now, I'm going to tell you a little bit about Sharon and Health-ettes. They provide consultation to strengthen and improve healthcare organizations, nonprofits, public and governmental agencies, health literacy services, and programs. Their goal is to support agencies to be successful in reaching their target population's health literacy needs. Now, for some, we're already going, huh? So now please tell us about just health literacy. Kind of give us what that is all about in a nutshell.
Well, if you look at the definition of health literacy, it means the ability of an individual to obtain, process, and understand health information.
Okay.
Now, that's a mouthful. If you look at this country, there are about 90 million individuals that are challenged with health literacy. And I don't know if you've ever gone into a grocery store and bought some over-the-counter medication, and they pull out this long insert, or even having a prescription fill. I mean, I'm a nurse, and with a PhD, I can't even understand a lot of that.
Yeah.
So I thought, you know what, there are many individuals out there, particularly healthcare providers, that are doing health education to a lot of populations. And with Obamacare, you bring it in a tremendous amount of uninsured individuals, and they're challenged with either poor health, poor education, a lot of variables that impact their ability to manage their chronic illness or even prevent it. And if you kind of look at, and I don't want to be on a roll here, so say stop, Sandra, if I get it going too much here. But if you look at Atlanta, there are about 1 million individuals that are challenged with low literacy, about 20% of the population. And I think Georgia is about number 10 in terms of the number of immigrants here that are foreign born, particularly around Central America. So if you look at those two factors, a lot of individuals are challenged with health literacy.
So now it sounds so that there's a particular target, because I even think when I think of health literacy challenges, even myself, for example, you mentioned going into stores. I know I developed an allergy to some chemical that's in preservatives for skincare products. And I had the name and I looked it up and I got all the other names of what they call it so I can check the products and the bottles. I got tired to say, you know what, I'm just not going to use this stuff because I don't have time to figure out which ones it's in, which ones it might not be in. So I'm even thinking with health literacy, even, not mixing it up with being illiterate or being low income or not being able to even speak English. But, a lot of well-educated people are still illiterate when it comes to health, correct?
That is so true. And I'll give you an example. I have a brother that is managing, he's only 56, and he's managing 3 chronic illnesses. And so the other day I was talking to him, I said, so how's it going? He said, well, I'm having some challenges. I said, so how many medications are you on? He said, 12.
Wow.
Now, and interesting enough, he had problems with the fact that some of them contraindicated each other. So there again was a window for health education that may have occurred or not, and he has a master's degree with either physician or nurse to say, okay, you need to watch these 2 medications. You might want to take a lower dose of this, a higher dose of that, or make sure you take it at this particular time or that particular time. So you're absolutely right. You don't necessarily have to be uneducated, but there are so many providers, nurses, doctors, pharmacists, school nurses that are doing health education, and so they need support, education, some technical assistance to strengthen their program, and any evaluation, and that's where my company comes in to help.
Okay. So then you more work with kind of the providers and those that are sharing information with the general public?
Exactly. For example, I just did a kind of a professional development with some school nurses at a large district here in Atlanta. And so these school nurses have other nurses up under them
Okay.
that are in the schools.
Okay.
So they said, you know what, this will be really helpful to those nurses that are in the trenches working with students
Right.
who have chronic illnesses, because they need help in terms of how can we help those parents and those kids managing their chronic illness. And so I'm working with the school districts, I'm working with healthcare organizations, insurance companies, because believe it or not, while the Obamacare may be a blessing, there are not enough healthcare providers to provide the service to these clients.
Okay. Okay.
So that's where I can help them strengthen and feel more confident in serving these clients.
That's fantastic, because you're right. So often we're dependent on the providers. We don't really spend a lot of time thinking about what the medicines are, how they work together. They may give us some instructions. We go home with the paperwork, we read it one time, but we're really dependent on them to know what they're prescribing to us works together, doesn't work together, how much it should be, and all of that. But so it sounds like you're part of helping people really get more knowledgeable for themselves, that you can't just depend on what the providers are telling you, but you've got to get more educated on that and how to really manage what's going on with your own body.
Exactly. And I also work with healthcare providers. For an example, many healthcare providers are doing outstanding jobs out there, and nurses. I want them to step back for a minute and say, look at the client that you're working with. Meet them where they are. Some of them may not be able to understand a lot of information.
Right.
What are the things that they could do? For an example, use simpler terms. Look at their health education materials. Is it written at a literacy level that the clients can understand? Are there some things that they want to do with their staff in terms of letting them know what they're doing at the federal, state, and local level to address this need? By the way, October is National Health Literacy Month. Again, to bring attention to the country about the importance of health literacy.
Okay. Now tell me some of the financial impacts when it comes to health literacy.
Well, that's a great question. If you look at this country annually, with the number of increased hospitalizations, return to emergency room, it costs this country anywhere from 106 billion with a B to $238 billion a year. Now, some of that could be impacted on a positive end with people understanding some of their treatments, being more compliant with medications, being more clear about some of the diagnoses they've been given. And you look at this country in terms of obesity, diabetes, that's growing tremendously. There was a report that came out called the American United Healthcare Foundation, and they looked at the health of different states.
Okay.
1 through 50, Georgia was number 36. Hawaii, I think, was number 1, and I think it was Vermont, Massachusetts, Colorado up at the top there. So that gives you some sense about where Georgia, and it's specifically, but also various states across the country in terms of their healthiness. And granted, I think people are being educated. They're cutting back maybe on, fast foods and soda pops, but still, the country needs help in terms of how can we make it healthier. And providing some health literacy is just a small piece of the puzzle to make them successful.
Okay. So now, and we've heard a bit about your background, but tell me a little bit more about Health-ettes and kind of how it came to be, and then kind of what your growth has been with Health-ettes.
Okay, thank you. Well, when I started out, I said, you know what, I used to be a pediatric nurse back in the day, and I said there are about 13 or 18%, I could be wrong, children in this country that are managing their chronic illness. And asthma is probably at the top. You have kids managing sickle cell disease. You've even got some kids that are managing diabetes, hypertension. So I said, it'd be nice if there was something out there besides those boring brochures that they could read that would be inviting, engaging for them, but also reinforce for them healthy behaviors. So I came up with these puzzles. And so they came in a little clear packet, and the kids just put them together. And as they put them together, they'd be able to see different messages around, did you eat more fruits and vegetables? Drink more water, not pop. Go out and play, get more exercise. And they could put them on the refrigerator, and as they go through the refrigerator, they'll see those messages reinforced to them many, many times.
Okay, so they're magnetic.
Yes, they are.
Okay, so then, because I don't know why I love kitchen magnets, but this is great because I would sit here and put them all together and get educated all at the same time.
Exactly. And I understand, like, Americans go to the refrigerator, I don't know, 8 to 11 times. I probably go 20 times. So you see, that's a perfect place
Right.
to put it.
You're standing around.
Looking, so what can I eat? Okay, but then you see that message as well. Maybe I need to grab a carrot stick
Right,
here or a
right.
celery stick something,
I love
or maybe I
it.
need to drink more water.
Love it. I
So
love it.
besides obesity, we also have ones for asthma
Okay.
and also for diabetes.
I love that. So they have different topics for the puzzles.
Exactly.
Okay, fantastic. So now, how do you use these puzzles? Is this something that you provide to the providers to give out to youth, or at the schools, or do they come directly to you to get them?
Well, in the past, you mentioned about growth. I've partnered with the Georgia Diabetes Association, and they had a school initiative to address obesity. So we partnered with them and gave those out for
Okay.
schools as they went out to do various
Okay.
education. I also partnered with Children's Healthcare of Atlanta. They did an asthma training for the providers, and so we provided some of these
Fantastic.
asthma puzzles for their professional development. I also have done some work with Literacy Volunteers of America. I wanted to try to implement a health education course and around various topics. So I've been doing various things, I
This
must
is
admit.
fantastic, and I'll tell you because I'm just so tempted to sit here and try to put this puzzle
Exactly,
together.
and that's what
I'm-
we want to do. Just
gonna do
pull
it. I
you
have
in.
to
Just
Remember
pull
that
you
we're recording, but I love it. You all see, and just the bright colors, everything grabs you. So so even for the adults, so don't take them from your children, but they're a lot of fun. So I can really see how you're going to be developing even more of those. That is a fantastic way to get people interested. So now tell me a little bit more, because you mentioned Obama and his program. Discuss some of the recommendations the federal government has identified related to health literacy.
Well, first of all, there is the Institute of Medicine put out a report called the characteristics, 10 characteristics of a health literate organization. One of them is get your leaders to be engaged in having a discussion about health literacy. Look at some of the policies that are currently around the hospitals. President Obama signed into law, it's called the Plain Writing Act, and it's guidance suggesting that federal agencies begin to use language
Yes.
that are
Okay.
less federal government languageese, if you will. So again, that's
Acronyms and all that.
exactly.
Okay.
Exactly. And then there's also many other, it's called the National Action Plan to address health literacy. Again, that's an effort to get organizations to partner with community organizations, schools, other healthcare organizations to address the importance of health literacy. And also, for an example, with my puzzles, they suggested if you're going to use health education materials, incorporate principles of using pictograms.
Okay.
People can understand
Yes.
pictures a lot better than verbiage,
Yeah.
because you get kind of drowned in that. And so they're asking them to look at their health education materials and see if it's written at a literacy level that they're serving, the clients that they're serving. And they're not saying dumb it down, but look at it and see, for an example, if you're using the term myocardial, heart would maybe a simpler term.
Right. Right.
Some people have said diabetes. Well, I've also heard in the community high sugar.
Right.
So you have to be sensitive to the clients that you're serving
Right,
in order to
right.
meet them so they can understand and take some control of their managing their chronic illness.
Right. This is fantastic. I mean, such good information. And sometimes you just don't think about it. We think of the basic information that we need about healthcare, eating right, and all of that, but not really even thinking about the information that's being provided to us, and why we may not be as interested because we may not just understand it. Or they
Exactly.
make it so complicated. So getting something that's much easier to understand. So now tell me, when it comes to your target audience, kind of who's your ideal client?
My ideal clients are healthcare providers,
Okay.
healthcare institutions, school nurses, nurse practitioners, principals even, educators, schools, pharmacists, obstetricians, dentists, anyone that's serving the healthcare needs of their clients. So it can range any broad spectrum of healthcare providers out there. The other thing I want to say is that, we're in a time where we're struggling for dollars, but health literacy could be the key.
Okay. Okay. Just from what they'll be able to save by just making that simple investment.
Exactly.
To get more educated. So I'll tell you, so now we hear who the target audience is, or who you're trying to reach out to, and outside of the first step, which is to contact you, what's another tip that you would give them in just getting started with health literacy? How to approach getting started with health literacy, improving the health literacy?
Have a conversation with your leaders, with your decision makers. with your administrators and say, you know what are we doing to be sensitive to and meeting the needs to improve the clients that we're serving? Let's look at health literacy. It's a conversation that's having nationally, at the government, at federal government level, and so it's clearly on a conversation on the radio for many. But is your organization part of that conversation as well?
Love it. Fantastic. Thank you so much for sharing. And now, please, before we leave, make sure you tell everyone how they can get in touch with you so that they can start implementing this and start getting your fun puzzles too.
My web address is www.health-ettes.com. That's www.health-ettes.com. Or you can email me at Sandra@health-ettes.com. And we'll be happy to help you, have a conversation with you. It's much easier than what you think, and we'll be able to provide a lot of technical assistance to you and suggestions.
That's great. Thank you so much for joining us,
Thank you,
Sandra.
Pamela, for inviting me.
Absolutely. I hope you all got some good information. Please reach out to Sandra. If you're one of those entities that she mentioned, from the schools to the healthcare providers and the institutions, please reach out to her to get the health literacy program started in your organization or your business, but also for the individuals that are interested in improving that health literacy that you have, and for those around you and in your community, make sure that you reach out to those entities and let them know that this is something that you would like to see implemented, not only for yourself, but for your children and for your community. Please be sure to share with them this episode. You can see it again at www.bizlinks.tv. You can also check us out on our YouTube channel at youtube.com/bizlinkstv. Share your comments. If you have any questions or information, we'll be sure to get that over to Sandra as well. But let us know where you fall in this area in talking about health literacy and what's going on in your particular community. For those that have the Roku box, you can also see our show out there on Roku on the HerTube channel, and then keep an eye out for the BizLinks TV network channel as well, coming soon on a Roku box near you. This is Pamela Alexander, your host for That's My Biz, and remember, we want to expose your business to the world. Thank you for joining us. Today's show can be viewed on demand on our website at www.bizlinks.tv. If you are interested in having your products, services, or special cause showcased on our program, submit an inquiry to that'smybiz@bizlinks.tv. In addition, information on advertising and hosting your own show can be found on our website at bizlinks.tv.